Cystic fibrosis. Cystic fibrosis is an autosomal recessive disorder caused by mutation in the CFTR gene on chromosome 7, most classically the delta F508 deletion. It is the most common lethal genetic disease in patients with European ancestry. Now, the pathophysiology, CFTR, is an ATP-gated chloride channel. In the lungs and GI tract, CFTR normally promotes chloride secretion, and in sweat glands, CFTR normally promotes chloride reabsorption. With a delta F508 mutation, the CFTR protein is misfolded, leading to defective trafficking, so the channel is absent from the cell membrane. The consequence is decreased chloride secretion and therefore decreased water and bicarbonate secretion into the airway and GI lumen. In response, there is increased sodium reabsorption through ENaC, which pulls more water out of the lumen, producing dehydrated, abnormally thick mucus in the lungs and GI tract. Increased sodium absorption also makes the transepithelial potential more negative. Now, diagnosis. The classic diagnostic test is elevated chloride concentration on the pilocarpine-induced sweat test. Patients can also present with contraction alkalosis and hypokalemia due to extracellular fluid sodium and water losses in sweat with accompanying renal potassium and hydrogen ion wasting, producing a loop diuretic-like effect. Newborn screening shows increased immunoreactive trypsinogen due to pancreatic duct obstruction. Now, complications by organ system. In the lungs, thick mucus causes impaired clearance and recurrent infections. Early in life, common organisms include Staphylococcus aureus, and later, especially in adulthood, Pseudomonas aeruginosa becomes prominent. Patients can also develop allergic bronchopulmonary aspergillosis, chronic bronchitis, and bronchiectasis. Imaging can show a reticulonodular pattern on chest X-ray, and there may be sinus opacification. Clinically, look for nasal polyps and digital clubbing. In the GI and hepatobiliary system, patients develop pancreatic insufficiency, causing malabsorption with steatorrhea and deficiency of fat-soluble vitamins A, D, E, and K. Over time, pancreatic injury can progress to endocrine failure, producing cystic fibrosis-related diabetes. Hepatobiliary disease can include biliary cirrhosis and chronic liver disease. In newborns, a classic presentation is meconium ileus. In reproduction, males commonly have infertility due to absence of the vas deferens, even though spermatogenesis may be preserved. Females can have subfertility due to abnormally thick cervical mucus, and menstrual irregularity may be present. Now, treatment is multifactorial and targets mucus, infection, and organ insufficiency. For airway clearance, use chest physiotherapy, inhaled hypertonic saline, and aerosolized Dornis alpha, which is DNASE, to reduce mucus viscosity and improve clearance. Azithromycin is used to reduce acute exacerbations. Ibuprofen can be used for its anti-inflammatory effect in selected patients. For pancreatic insufficiency, treat with pancreatic enzyme replacement, such as pancrelipase. Finally, CFTR-directed therapy. CFTR modulators are used alone or in combination, and their effectiveness depends on the specific mutation. There are potentiators such as ivacaftor, which increase channel opening and improve chloride flow, and there are correctors such as lumacaftor and tezacaftor, which improve CFTR folding and trafficking, so more protein reaches the cell surface. So, cystic fibrosis is delta F508 CFTR, dysfunction causing thick mucus, high sweat chloride, recurrent lung infections and bronchiectasis, pancreatic insufficiency with fat-soluble vitamin deficiency, meconium ileus, and male infertility, managed with airway clearance, antibiotics, enzyme replacement, and CFTR modulators.